Hello friends, let us now learn some important points about the intracerebral hemorrhage. So intracerebral hemorrhage can be parenchymal. Here the hemorrhage is present mainly in the brain parenchyma. This intracerebral hemorrhage is the most common cause of intracranial hemorrhage, and the most common cause of this intracerebral hemorrhage is hypertension, which causes the rupture of small perforating arteries and arterioles. If you were asked most common site of this intracerebral hemorrhage, it is in basal ganglia, that is in putamen. Then we have second most thing, which is called as subarachnoid hemorrhage. Then subarachnoid hemorrhage, if you see, subarachnoid hemorrhage is the second most common cause of intracranial hemorrhage is subarachnoid hemorrhage. The most common cause of subarachnoid hemorrhage is trauma followed by rupture of berry aneurysm. Right? Then if you were asked what is the most common site of rupture of berry aneurysm, that is in anterior circulation. In anterior circulation. Then if you were asked what is the most common site of rupture of extracranial aneurysm, most common site of rupture of extracranial aneurysm is mainly the infrarenal abdominal aorta is the most common site of rupture of extracranial aneurysm. Then if you see the berry aneurysm is most common type of intracranial aneurysm. So this is actually a saccular in appearance, that is like a sac like appearance like this, and it usually arises in the bifurcation points of intracranial arteries. And 80% of these berry aneurysms, 85% of these berry aneurysms occur from the anterior circulation of circle of Willis. Okay, now if you see the occurrence of berry aneurysm, this is first you will have there is a basilar artery which gives rise to two vertebral arteries, and we have a internal carotid artery. Through the internal carotid artery we get middle cerebral artery and an anterior cerebral artery, middle cerebral artery and an anterior cerebral artery. Now through two anterior cerebral arteries are connected by anterior communicating artery, whereas the posterior cerebral artery communicates with this middle cerebral artery by posterior communicating artery. Here there is posterior communicating artery. Now the most common site of berry aneurysm is between the anterior communicating artery and anterior cerebral artery. Here anterior communicating artery and anterior cerebral artery. Okay, this is first most common site. This is first. Okay, second most common site is the next most common site is posterior communicating artery and internal carotid artery. Here this is internal carotid artery, this is posterior communicating artery. This is the next common site. Then the next common site is this middle meningeal artery will bifurcate into the two. So this bifurcation of middle cerebral artery will bifurcate into two. This bifurcation you will see one more berry aneurysm. Then we have intracranial carotid aneurysm is carotid bifurcation. It is not seen here, but the next is whenever there is intracranial carotid bifurcation, then you will see one more aneurysm. And in the bifurcation of vertebrobasilar system, like here where the vertebral artery gives rise to two basilar artery, here you will see the aneurysm. Okay, so these are the different sites where aneurysm is seen. Next, if you see the risk factors mainly include the presence of hypertension and smoking. The Wall of the berry aneurysm, this is actually the wall of the berry aneurysm is thickened and it has hyalinized intima. It is thickened and it has hyalinized intima. Then there are certain conditions which are associated with berry aneurysm. Now conditions associated with berry aneurysms are very important. These include, first, Marfan syndrome, Ehlers-Danlos syndrome, then we have coarctation of aorta, autosomal dominant polycystic kidney disease, neurofibromatosis 1. All these are associated with this berry aneurysm. Then if you see the rupture of berry aneurysm, most common site of rupture of berry aneurysm is at the dome or apex. Dome or apex is the most common site of rupture of berry aneurysm. Once there is rupture of berry aneurysm, it leads to intracerebral hemorrhage, or it can also result in subarachnoid hemorrhage. Okay, then sometimes the berry aneurysm may not rupture. In unruptured berry aneurysm, it is most completely asymptomatic. So this is about the intracerebral hemorrhage. Thank you for subarachnoid hemorrhage. Subarachnoid hemorrhage. Thank you for watching.